I always have to declare my interests or conflicts of interests. I'm not a geneticist of any kind whatsoever. I'm an anatomical pathologist, but with a keen interest in what's happening now and what's going to happen in the future and how the future is going to shape what we also need to do now. And from that perspective, I wish to share with you a few thoughts on pathology and genetics and how they can relate, and perhaps should relate in a way slightly different from what we did historically. Also a word of welcome to everybody. Some of you went to a lot of trouble to be here today, and it's much appreciated, and I trust that the proceedings of today will leave you with some thoughts for the rest of this weekend and for the future. Now, in a nutshell, the diagnostic process, which is the business of pathology, begins with specimens submitted by healthcare workers, usually clinicians, and these specimens can be of a very large range of different types, including anatomical pathology, chemical pathology, and so forth. And these are submitted for analysis and interpretation to generate relevant information that can be used by the clinician to guide clinical care and management of the patient. Now, pathology results, and genetic tests are not different, are interpreted within the context of the clinical presentation of the patient, and with due consideration to other special investigations that may be relevant, for example, imaging. And this integrated profile of information is then used through clinical pathological correlation to provide an accurate diagnosis and relevant information to guide patient management and prognostication. Now, we've seen during the past few years a rapidly increasing integration of advanced technologies into laboratories to confirm the difficult diagnosis. No longer can the pathologist just look down the microscope and say A, B, or C. I mean, those days are history. Increased technologies to provide information relevant to patients' prognosis and therapeutic interventions and personalization of management, especially in the fields of breast carcinoma and cardiovascular pathology here at our institution, and of course quality assurance. Now, we've seen during the past years a number of technologies that found their way into the field of diagnostic pathology, such as immunohistochemistry and mass spectrometry, proteomics, all words that didn't even exist in the vocabulary of a pathologist as recently as 10 or 20 years ago. And of course, included now in this range of technologies, we also include molecular pathology, which we apply in a number of different fields, such as tumor pathology, cystic fibrosis, and the diagnosis of a number of other conditions. Now, the rapidly expanding global interest in molecular genetic testing for the early detection of disease and the subsequent opportunity for preventative or therapeutic interventions to influence the outcome of a disease confirm the importance of this evolving field in healthcare. For this is only the beginning. Now, it's important to emphasize that the need for pathology tests, including molecular genetic and molecular pathology tests, is primarily determined by clinical need. Referring to patients' expectations, and patients have growing expectations in view of being better informed nowadays. Also, clinicians' growing demand for better and more relevant information to guide clinical care. And also current developments in health science, health economy, and health policies that increasingly point towards the importance of evidence-based guidelines to guide clinical care. Now, matching disease diagnosis and therapeutic design with a clinical picture, pathology, and genetic profile of the patient is an evolving area that is likely, not likely, it's definitely going to become more and more important. And for this reason, the Department of Pathology here at Stellenbosch and Tygerberg launched an initiative in 2008, it's quite recent, to develop a pathology-supported molecular genetic testing based on an integrated service and research approach. And we called it pathology-supported genetic testing. Now, many molecular genetic tests are well established in routine pathology practice. And you will see from your request forms available from pathology practices that that is indeed the case. And such test results are increasingly required by clinicians to determine patient management. And I've listed just a few there. The list is growing every day. But those are a few examples of very relevant tests without which it's not possible, actually, to manage the patients properly. Now, some of these tests, akin to some other non-genetic pathology tests, not unique to genetics, have not been adequately validated, and the scarcity of sound scientific evidence rightfully challenges the ethical and scientific justification of the routine application of these tests in clinical practice. However, and that's an important however, there's a growing clinical demand for such tests. And this clinical demand drives the need to offer such tests in an appropriate clinical context and as part of an integrated pathology-based platform. Note those words, they are very important. For these tests in isolation can be a disaster. Pathology supported genetic testing is a logical addition and expansion of well-established clinical practice to subclassify complex diseases into treatable entities. And I think the example of cardiovascular disease is well known to probably all or most of you, where the correlation between the presence of well-established genetic and lifestyle risk factors and relevant biochemical profiles could be used to determine gene expression and to monitor response to the applied intervention strategy for that particular patient. It is important to develop innovative approaches to risk management of complex multifactorial diseases, which could be applied in a clinical context where the genetic test results are fully integrated with relevant clinical information and other diagnostic pathology data in order to provide informed clinicians, also very important, with adequate information to facilitate patient care. The traditional way evolved over the past decade was pathology as a diagnostic service to just about every possible clinical discipline. And clinicians used pathology tests extensively to provide clinical care and prognostications to patients. The idea was that molecular genetics recently moved into the field of diagnostic pathology, and it's now part of the tools available to pathologists to provide the integrated data for patient care that in fact forms a new layer that can be accessed by clinicians in the interests of the patients in particular. And it's this integrated data for patient care that we are actually talking about today and that we see as part of the future. Now, in order to address the important ethical and scientific issues pertaining to pathology-supported gene-based intervention, the information must be captured in a scientific database, specifically designed for that purpose, as part of properly designed and ethical approved research projects that will advance evidence-based medicine. The idea is that as you provide the service, as clinicians accumulate information, and as we learn from the interventions that follow such information data sets, that we can move into the future with a growing understanding of what this new era actually implies for patients based on evidence-based outcomes. So in conclusion, matching disease diagnosis and therapeutic design with the clinical picture, pathology results, environmental risk factors and genetic profile of the patient is a rapidly evolving area which is going to become more and more important. And the future has arrived. And I wish to conclude with the words of an American-Canadian writer, Gibson, who coined the term cyberspace, by the way. And he said, the future is already here, it's just not very evenly distributed. And what we are trying to do today, and what we've been trying to do for the past few years, is actually to distribute the future right now. And I hope that today you will share in that experience. Thank you.